Welcome to City Club of Portland's Friday Forum. I'm Lisa Watson, President of City Club's Board of Governors. For over 100 years, City Club of Portland is where civic-minded people come together to make Portland and Oregon a better place for everyone to live, work, and explore. We're gathered at the Sentinel Hotel, along with all of you joining us through KGW's website, Facebook feed, or news app, X-Ray FM, or on Open Signal's community media television stations. The generous support of City Club's media partners and corporate sponsors enables us to put on the state's best civic programs week after week. I'd like to recognize City Club's fall sponsors, Avangrid Renewables and Morel Inc. I'd also like to thank today's program sponsors, Kaiser Permanente and Central City Concern. Lastly, I'd like to acknowledge the participating organizations who helped promote today's event. The Alano Club of Portland, We Can Do Better, the Fourth Dimension Recovery Center, Portland State University School of Public Health, OHSU Addiction Medicine, Recovery Works Northwest, Oregon Society of Addiction Medicine, Washington Healthcare Access Alliance, and Oregon Recovers. Please show your appreciation. Like much of the rest of the country, Oregon faces a growing epidemic of substance use disorders, including alcohol, opioids, and other addictive and dangerous drugs. Unfortunately, the rate of substance use disorders in Oregon is higher than the national average, with 2.9% of the population engaging in illicit drug use or misuse of prescription drugs, and approximately 7% having an alcohol-based substance use disorder. These numbers have a high social cost on our communities, producing an estimated $6 billion in collateral damage to Oregon's communities in the form of mental health needs, crime, unemployment, and death. Here today to talk about addiction from the personal to public policy is our national speaker, William Moyers. Mr. Moyers is the Vice President of Public Affairs and Community Relations at the Hazelden Betty Ford Foundation, based in Minnesota, and the author of a best-selling memoir titled Broken, My Story of Addiction and Redemption, about his multi-decade struggle to overcome addiction. Our moderator today is Dwight Holton, former U.S. Attorney for Oregon and current CEO of Lines for Life, a not-for-profit organization working to prevent substance misuse and maintain a 24-hour crisis line. Mr. Holton also is statewide coordinator for the Oregon Coalition for Responsible Use of Meds, founded in 2013 to reduce misuse and overdose from prescription drugs. Please welcome our speakers.
Good afternoon and welcome. We are both delighted, I know I speak for Mr. Moyers and myself, that City Club has taken on this incredibly important public policy issue. The thought, carefulness, and intellect and perseverance that City Club bring is a force majeure in Oregon, and we appreciate the interest in the issue. William, we come at this, you and I, from very different places. I spent 16 years as a federal prosecutor. You're a nationally recognized thought leader on addiction and recovery. What are we doing on the stage together?
I'm not sure. No. We're here because the community is here. And this is not about my perspective necessarily or your perspective, but the perspective that is inherent in the participation of everybody who has taken time out of their busy lives to come and hear us and to participate in what really we believe at Hazelden Betty Ford needs to be a community-based solution to a community-based problem. Addiction does not discriminate. It's everybody's issue in this room and in this community and in this state and in this country. And we believe at Hazelden Betty Ford that while addiction does not discriminate, neither should recovery. And whether you are from the bucolic suburbs of Yakima or whether you're from the inner city of Portland, everybody deserves an opportunity to find the solution. What you and I hope will be able to do today is to talk about the solution in a practical, holistic way so that everybody who's had a chance to be here today can take back to their own families, their own neighborhoods, their own communities some of what we talk about and that we can plant those seeds so that we as a nation begin to shift away from a focus on the problem and a focus on the solution, a solution that I've been living in my own life for many decades now, and a solution that I know there are many people in here who are living as well. Because while addiction does not discriminate, as I said, neither should recovery, and everybody should have an opportunity to recover.
William, tell us a little bit about your journey and how you came to this mission.
Well, who would have thunk it, right? I mean, I smoked marijuana for the first time at the age of 15, the same way a lot of teenagers do. I just experimented. I never could have imagined that my casual, willful, deliberate use of marijuana would lead me down into the abyss of addiction. So that in 1989, when I was 30 years old and living in New York, I was holed up in a crack house in the inner city of Harlem. I was a blight on the community. I was a detriment to all those who knew me and all those who did not know me. I added nothing of value to my participation in life. I was a full-blown addict and alcoholic. I was in and out of treatment twice at Hazelden in 1989, and then again in 1991. I had some continuous abstinence, and I emphasize the word abstinence because, as we know at Hazelden Betty Ford, addiction is an illness of the mind, the body, and the spirit, and to recover from it requires attention to the mind, the body, and the spirit. So I was dry for a couple of years while I worked as a journalist at CNN between 1991 and 1994, and then I relapsed with my chronic illness because, as we know, there is no cure for addiction, at least not yet. There is a solution. And so I was dry but not recovering, and I didn't take care of myself, and so I relapsed. And I ended up in a crack house in Atlanta, Georgia. And 23 years ago, October the 12th of 1994, I walked out of what I hope is my last crack house. On that morning of October 12th of 94, I couldn't imagine living with drugs any more than I could imagine living life without drugs. I just couldn't function. I would have killed myself had I had the guts to do it. While I'd given up on me, my family and my community had not given up on me, and so they staged an intervention that saved me from an illness that was about to kill me. And I found recovery because I was able to get one more chance. And then a couple of years later, I ended up literally stumbled into a job at what was then called the Hazelden Foundation, based in Minnesota. We're now called the Hazelden Betty Ford Foundation because we've merged with that venerable institution in the desert of Southern California, the Betty Ford Center. I ended up working for Hazelden starting in '96 as a policy analyst, and here I am. I mean, I'm a prime example of the power of addiction and the promise and possibility of recovery. So that's how I got here. I didn't plan it, but I know I'm one of the fortunate ones, one of those who got well, and I have found it to be my responsibility to work as hard as I can day after day, along with my colleagues, many of whom are here today, my responsibility to change the terms of the debate for the sake of those who still suffer from my illness. That's it.
Thank you. Your story, your experience, as remarkable and poignant as it is all too common in many elements. The epidemic of addiction we are seeing in the United States is turning all sorts of things upside down. For the first time in recorded history, the mortality rate for white men is going down. Is going up. United States. It's always gone down ever since we recorded it. Right. And it traces back to addiction. That's obviously just a reflection of a broader challenge in society. Something like 60,000 people will die from drug overdose this year in the United States. That means that 6 or 8 people will die while we're sitting here today. How did we get here?
Well, my good colleague and friend and fellow traveler, Dr. Marvin Sepula, is sitting right over here. He's the chief medical officer of the Hazelden Betty Ford Foundation, a good friend and colleague of mine. And We were talking about this very thing, Dwight, last night at dinner. Just the two of us had dinner here in downtown Portland. You know, the opioid epidemic has kind of leveled the playing field. To your point, the mortality rate for white males is what it is, in part because of the propensity of the overprescription of pain medication in this country. Yet sadly, the opioid epidemic is just, it's a new epidemic, but it's not a new problem. The problem of alcohol and other drugs has been around as long as man has crushed grapes. You know, the Egyptians had a cookbook for opioids. They had 3,000 different recipes in that cookbook 3,000 years ago. So back 3,000 years ago, the Egyptians were figuring out, you know, elixirs for everything that ailed them through the use of opiates. But whether it's opiates or alcohol, marijuana, methamphetamine, we've always had a problem in this country. Why we have gotten here to this stage, to the point that the City Club is having this conversation today, is because the opioid epidemic is everybody's problem in a way that everybody can see. Alcohol and other drugs have always taken a terrible toll on society, but because of the propensity to overprescribe pain medication starting in the late 90s, perhaps it was in the late 90s, we've become aware of it to the point that we're here talking about it. But whether it's opioids, as I said, or marijuana, or methamphetamine, or alcohol, which is the most used and abused drug in the country, alcohol, we only have developed the awareness around it in this last couple of years. Last point I wanted to make is that until now, addiction has largely hidden in the shadows of public intolerance and personal shame. But because of the opioid epidemic, and because we cannot deny it anymore, that addiction has really come out of the shadows now for I would say the first time, comprehensively, for the first time in our history. To the extent that we're not only looking to figure out ways to combat the problem, but we're also trying to promote the solution in what we are now talking about in terms of treatment and recovery support. So I'm really heartened to see a room filled with people who are busy doing other things, talking about a subject that we used to never talk about. Gives me great hope. That's how we've gotten here.
So let's come back to the stigma question in a second that you touched upon. I want to ask first about something you mentioned, the leveling of the playing field that opioids have played. There's an equity lesson in that. It's undeniable that an outside observer could look at the experience in the United States over the last 40 years with opioids and say, no one cared when this was a largely black drug or a largely non-white drug. Right. And now all of a sudden we care. Leaving aside the pain that must evoke when we make that recognition, what public policy lessons can we learn about next time and about how we approach the addiction crisis that come from the fact that we really missed this, many of us missed this, and didn't seize upon it as an issue until it was that close to home?
You know, Richard Nixon is credited with coining the phrase, the war on drugs, in 1969. It's a fact. He came up with that term. But the reality is that we've been fighting a war on drugs since colonial times. It was the Continental Congress that in 1787 passed the 15-gallon rule. And that was a law in this country that you couldn't buy rum in any quantities less than 15 gallons. That was designed to keep rum out of the hands of those who couldn't afford to buy it in quantity. I don't know about you, but I would have never had a problem with buying 15 gallons of rum. But my point is it was Dr. Benjamin Rush, who's often credited with being the father of modern psychiatry, who was writing a treatise on the impact of substances on the human mind and body with the means of remedying them. So we've known this problem in this country since the 1700s. long before Richard Nixon ever waged the war on drugs, but it was always a war of them versus us being the United States and them being the addicts and the alcoholics out there. And it was always easy to sort of marginalize them. Yeah, they live under bridges, they're different colors, they don't work, they're moral degenerates, whatever. The opioid epidemic, finally, the silver lining in it, and there isn't much of a silver lining in the sense of the terrible toll it takes, but the opioid epidemic finally has allowed us to see that this war on drugs that we have been fighting in this country for 200 years has failed, and that we as a nation, we as taxpayers, we as public prosecutors or private citizens, we need to do something different. And what we need to do differently is to recognize that the war on drugs has been a war against sick people. And that doesn't excuse that. I speak in prisons all the time, and I always say to inmates, addiction is not an excuse, but it is an explanation. You do the crime, you do the time, stone cold sober or stoned out of your mind. It's not an excuse. We as recovering people have to own what we did, and we have to own our recoveries. But unless and until we have the resources as a society, as a community, as a nation to deal with this issue, we're never going to get on top of it. So we've always spent 80% of the federal budget on tough law enforcement and interdiction. Nothing wrong with tough law enforcement and interdiction, but that 20% that's left is what goes to prevention and research and treatment and recovery support. So we need to rebalance the agenda, if you will, rebalance the playing field in a way that shifts some dollars away from the punishment part of this and puts it into the solution piece, which is treatment and recovery support. So that's where we've come, and that's what the great hope I have. But the other thing, too, that is important, Dwight, to emphasize, and we're going to do this tomorrow, thanks in part to, I can't remember the name.
Oregon Recovers.
Oregon Recovers. I know you're going to talk about this, and the Alano Club and so on. We as recovering people and families who know this issue firsthand have got to do more to stand up and speak out and put a face not on the problem, but a face on the solution. Here I am. I've been living the solution for 23 years now. No one would even know that if I didn't share it. So we as recovering people and as families have recognized that we have to do our part, even while we ask the policymakers in Salem or the policymakers in Washington, D.C. and others to do their parts as well. And we need to emphasize, we need to prove with our own faces and our own voices that addiction does not discriminate, treatment works, and recovery is possible.
And Oregon Recovers tomorrow is convening for a rally for recovery at 10 a.m. in the park blocks to carry that exact message. There are 26 million people in long-term recovery in the United States. Is that about right?
Yes.
And I figure every single one of them has someone who loves them. So that's 52 million people. It seems to me that that would be a very potent political force in transforming our approach from treating addiction as a moral failing to treating it as the chronic illness that science tells us it is.
Right. We have to take a public health approach to a public health problem. And look, I know I'm biased. I'm a product of a public health approach in the sense that, or a health approach in the sense that I got 4 treatments over 5 years. I had access to care when I needed it, even when I didn't think I wanted it. And so I'm biased. And I work for a nationally renowned nonprofit addiction treatment provider. So of course I'm going to be biased that treatment works and recovery is possible. I can't help it. It doesn't work for everybody any more than diabetes treatment works for everybody, or that breast cancer treatment works for everybody. But the reality is that a large percentage of us who become addicted and who can access treatment oftentimes more than once, we can recover. And that's why I've been pushing this for a long time. Some people say, well, William, you only push it because you work for a treatment provider. Well, I am given that opportunity since I got hired in 1996 to be the advocate for the organization. But actually, to be candid with you all, and brutally honest, the reason why I push the issues that I push is because I want more people to have the opportunity that I had. And what I can do first and foremost, and what I know will result as a result of us being here and the media also covering this, is that by you and me being on the stage, we will plant seeds today, seeds of hope in people who don't have any hope. And that's, at the end of the day, what I like doing. I just like giving people hope that they can overcome this illness in a way that can apply to them as well, not just me.
You mentioned diabetes as another chronic condition that we treat very differently. No one who shows up in the emergency room with their insulin levels off is given a hard time about eating a Snickers bar. Likewise, and I think more important as a public policy question, no one goes to a emergency room for treatment of diabetes and is told, we don't have any room, can you make it here in about 2.5 weeks?
Right.
So how do we bridge that? How do we push through that to treat addiction as the chronic condition that it is?
Well, we need more funding. Well, first, part of the solution is being recognized here. Kaiser Permanente bought a table today, right? I think there we are, right there, of course. And I don't know if there are any other insurance or healthcare providers who are out there, but we're the solution. I mean, I lobby. When I got to Hazelden, my first day on the job was February the 29th. It was a leap day. I've always been an odd person. February 29th, 1996, my boss, who was the CEO at the time, Jerry Spicer, said, William, I want you to go out and change public policy around addiction. I said, sure. He said, I want you to get insurance companies to stop discriminating against people who suffer from this illness. And he said, and while you're at it, get rid of the stigma. And I said, sure, I'll be happy to do that. I said, where's the money? Well, where's the money? Well, Greg Fisher, who's back here at this table, he and I raise money for Hazelden Betty Ford. We're always out raising money because you can't have a mission if you don't have a margin, right? So we don't have a lot of money at Hazelden Betty Ford to do the kinds of advocacy work that we're doing right here today. So I said, okay, no problem, no money. Where are the troops? Where are we? We, I see some of us out there. Where are we? There we are back there. Okay. Well, thank you for publicly disclosing that you're part of the we. We didn't have a lot of those either. So we systematically set off in 1996 to begin to change public policy by getting insurance companies to cover addiction like they cover any other chronic illness. Duh. Well, that was a big push. It took a long time, and if we hadn't had the we part, we hadn't had the advocates willing to stand up and speak out with faces and voices of their own and their families, we probably would have never gotten this issue before Congress in a way that we did, to the extent that in October, it was 9 years ago this month, President Bush signed into law the parity bill that for the first time in American history required most insurance companies to cover addiction like they cover any other chronic illness. That was a huge step, that consumers of health care could use their insurance to access this chronic disease, of course. And since we've done that, as Heidi Wallace, who is the executive director of our facility here outside of, in Newburgh, she well knows it, 90% of our patients now access addictions treatment at Hazelden Betty Ford with their insurance, as we should. That was a big step, Dwight, towards getting what we needed. 2 years later, we got President Obama to include mental illness and addiction in the basic benefit umbrella of the Affordable Care Act. And as I've warned my colleagues in red states, be careful what you ask for. Because now we're seeing that rolled back. It's been delayed here in Congress right now, but ultimately the Affordable Care Act is going to be dismantled. I don't say it's going to be destroyed, but it's going to be dismantled. But addiction treatment is covered in there too. And that really applied to a lot of these red states where the opioid epidemic has hit right at ground zero. That's my long-winded explanation to your question, until we see this issue for the issue that it is, one that is a health care crisis, we can never get on top of the solution. We have made great strides since I started working at Hazelden Betty Ford. Some of those are in peril now with what's happening at the federal level. but some of those are well ensconced, both in how insurance covers it and the recognition of healthcare providers that addiction is at the core of almost all the root causes of their chronically ill patients, whether it be emergency room visits or other sicknesses and so on, that addiction to alcohol and other drugs is at the root cause. And if you want to prevent somebody from coming back to the ER or going back to jail or ending up back on the streets of Portland, one of the ways you can combat that is by providing people with treatment in a way that empowers them not only to take responsibility for managing their illness, but helps to create in them a healthy entity. So we've come further than I ever could have imagined when I started working at Hazelden, but one of the ways we've done it is by getting people like me and those who raised their hands around the room just a few minutes ago, like we will do tomorrow here in Portland, to stand up and put a face and say, yeah, I'm one of those, in the same way that people with depression or breast cancer or HIV/AIDS have done it in the past. It's really important that we stand up and we speak out.
Let's talk about that, the power of Voices of Recovery in tearing down the wall of stigma, and maybe start, if you can, about telling us about the power of stigma, both as a person struggling with addiction, as a family member, and as a public policy matter.
So look, I was really heartened today that I was introduced in the media that ahead of time and in the flyers at your tables as just being the person that I am. I mean, I'm 58 years old now, so I think I've earned the right to be the person that I am. But I don't ever deny that I'm also the son of. Man, I'm the son of a prominent person, Bill Moyers, the journalist, right? He's won 60 Emmys and 4 Pulitzer Prizes. He was President Lyndon Johnson's chief of staff and press secretary. I remember trips on Air Force One, weekends at Camp David, Easter egg hunts on the South Lawn of the White House. My father set the Peace Corps into President Kennedy in 1961. But before all those things, as some of you know, because I've shared it before, my father was an ordained Southern Baptist minister. When I was born in 1959 in Fort Worth, Texas, my father was in seminary. And he and my mother, who've been married now for 63 years, he and my mother pastored a small church in Central Texas. I only share that, and I not only share that, but I share that to emphasize that when I speak that way, people can't believe that I could be an addict and an alcoholic. Wait a minute, you come from a really prominent, successful, nice family. You believed in that up there, whatever that is. You went to college in Virginia. You did this. And what do you mean you're an addict and an alcoholic? The stigma was so great when I came out for the first time, and that's what I did, was come out in the same way that people with HIV/AIDS or depression or breast cancer have come out over the decades. I came out, people couldn't believe it because the stigma was so powerful that they couldn't imagine that a nice guy like me, from a nice family like mine, could have a brain that's wired differently. And that is, it doesn't excuse it. I smoked marijuana for the first time. It turned on a light switch in my brain, which I could not turn off of my own free will. It's that simple. No, it's not that simple, but you know what I mean. I have a susceptibility to the genetic predisposition of addiction. And only could I combat that stigma by sharing my story. Not my story of addiction as much as my story of the rest of my life, so that people could see that you could even come from a learned, loving, not broken home family and still have a susceptibility to end up in a crack house if you have this kind of thing. So the stigma is really grounded in 200 years of perception in this country that I don't look like this and don't come from families like mine. But that's the truth. And the only way I've discovered I could combat that stigma, I mean, when the head of Hazelden said, I want you to go out and change public policy, and we didn't have the money to do it, and he said, we'll go change it with the troops, and we didn't have people standing up and speaking out like we will tomorrow here. I figured the only way to do it was by sharing my own story. It helped that I happened to come from a prominent family, but it also helped that I was a multiple relapser. And then I needed 4 treatments over 5 years. It also helped that I was a college graduate. It also helped all those other things that go into the dynamic. And so that's really what the stigma was all about, was getting the public. And by the way, the first place I ever did it looked just like this. The very first time I ever came out was at a Rotary Club meeting in St. Paul, Minnesota. Yeah, I had crafted this beautiful speech on the impact of alcoholism in the workplace. I'd spent weeks, it was my first public event as a public policy specialist, the impact of alcoholism in the workplace. Had this beautiful speech. I got up at the podium. They had lunch, you know, the rubber chicken you have and all that stuff. I don't know what you guys had, but I know it was better than what they had. And I got up there and I started delivering this speech, and I looked out over the audience, and people were going like this. You know why? Well, notwithstanding the rubber chicken after lunch, was the fact that they already knew the problem of alcoholism in the workplace. We as a nation have always known the problem of substance use problems. So they weren't hearing me tell them anything new. And there I was in my very first speech for Hazelden Foundation, and I was losing my audience. So I realized in that moment that if I was going to grab them, it wasn't going to be by talking to them about the impact of alcoholism in the workplace. It was going to be by telling them my story. So I said, actually, let me explain this situation, this problem to you in another way. And at the podium at the St. Paul Rotary Club that day in 1997, I said, my name is William Moyers. I'm an alcoholic and an addict in recovery. This is what one looks like. You could have heard a pin drop. People were shocked. And I come from a liberal community like yours where people are sort of open-minded about these things. But they said, wait a minute, you're the son of, you're on the board of 4 not-for-profits, you're on the board of a bank, and you're a really nice guy who pays taxes and owns a nice old home in St. Paul. You're telling me from the podium that you're an addict and an alcoholic? People couldn't believe it. And it was on that day that I realized if we really want to change public discourse, public policy, it was going to be by standing up and speaking out and saying, this is what the problem looks like, and this is what the solution looks like. So that was a long-winded response to a question that I can't remember what it was, but it sounded good.
So you and Hazelden Betty Ford were very prominent in a terrific documentary called Anonymous People, which you can find online, that goes to precisely this question of how do we find all the William Moyers in the world. I look around the room and there are a bunch of brave souls and who are friends here who have played that role in this community. Yep. We're hoping tomorrow with the Oregon Recovers rally at 10 a.m. in the park blocks to multiply the number of voices there. What's your formula for multiplying those voices and applying them so that we take that? I've always thought of it as energy potential, William, where you've got 26 million people, 52 million people, which you count their loved ones, and in high school physics you learned about the energy potential of the glass falling off the table. How do we push that glass off the table?
Well, that went back, that's the question we could spend the rest of the time on. I know we're going to have a good Q&A here in a little while, too. Doctor, thanks, by the way, for all you did to help us get prepared for today, because this is the result of it. And I really appreciate your efforts. We had many conference calls around this, and I thought, man, this guy is prepared to the max. And now I see why, and I really appreciate what you did. And I want to tip my hat to you in the audience to recognize that you've taken the time, and we want to have Q&A about that. But we could talk for the rest of the time about this whole issue of anonymity. But so far, in all the materials you got leading up to this moment, and everything I have shared so far, I have not revealed to you how it is that I recover, have I? All you know is that I have recovered. That's really all that matters, is that I have recovered. To your point, there's 25 million people in this country who consider themselves in recovery from addiction. But if you ask Alcoholics Anonymous in New York at the central office there, how many members do you have? AA will tell you they only have 2 to 3 million active members. So where is everybody else? Where are we? Well, some people recover in the 12 steps. Some people recover in yoga. Some people recover in church. Some people recover by just saying no. Some people recover in running clubs, whatever. There's many pathways to recovery, and more than ever, as Dr. Sepla would articulate, there are many, many ways to get here. Hazelden Betty Ford happens to be one way, using the 12 steps as a cornerstone. But never in my public conversation do I ever reveal how I recover, unless somebody asks me. In which case I feel I owe it to them to tell them how I recover in the same way I talk about the grittiness of my addiction. But I never speak for or on behalf of, nor pretend to represent any pathway or any recovery program. I just say, my name is William Moyers, first name, last name. I give my address if that's relevant. And I say I'm a person in recovery from addiction. This is what one looks like. I don't ever talk about it as a member of that kind of group. I don't use the lingo of the recovery program that I recover in. I don't ever say, oh, I just let go and let God, or I do it a day at a time. Nothing wrong with that, but I just don't go there. So it's real important that people who are in a recovery program that embraces the spirituality component of anonymity understand that you can be an advocate for recovery as long as you don't do it as a member of any group, or as long as you don't do it as pretending to talk about it. So I never represent my recovery pathway, but I always stand up and speak out. And it is really important that people who have had access to treatment, oftentimes more than once, recognize that they have a responsibility to those who still follow, those who still suffer, for us to stand up and speak out. Not as members of a recovery group, yes, as people who have recovered. I go around talking about that all the time. The one place I don't talk about it is in the rooms of my program of recovery, because I don't ever bring into that discussion anything other than what matters to the people who are there, which is to talk about our own recoveries. Alcoholics Anonymous has survived for 70 some odd years, in part, 80 years, because it has stayed out of public discourse. Good. But that doesn't preclude people who might be in it from being part of the public discourse as long as they do it as people in recovery and not as members of any group. Then, to take it one step further, to include family members as well. It is really important that if we're going to continue to push the paradigm shift that is happening in this country, if we're to push it, we've got to include family members who have been struck firsthand by addiction. It is an epidemic, but hopefully also those who have experienced recovery as well. So we've got to include family members, and then to professionals who work in the field. Do we have anybody here today who works in the addiction treatment field? Okay, so here's, good. So I'm looking at you behind Dr. Sepala here with this shirt on. Just raise your hand here. You don't do what you do for that high salary that you get paid, do you? You do what you do, why? Because you know you make a difference in the lives of people like me. It's important that professionals in this field start to talk about your successes. You know you make a difference. And when we can get professionals, clinicians, administrators, therapists, whatever, when we can get professionals who in this field to start to talk about your successes, then we will begin to continue to push that paradigm in a way that will embrace this as a public health problem that it is.
Let me ask one last question before we go to questions from the audience. Well, you may want to hear the question first. I'm giving you the magic wand. You have in this room some of the leading policy advocates, policy thinkers, policy activists in the state of Oregon. If you can wave a magic wand and change policy, what policies will be most effective at getting us out of the hole we've dug?
That's a complicated one, and I'll turn it back and shift it slightly by giving you my call to action. I know Heidi and Greg, Lori, Dr. Sepala have heard this before. what a gift. What a gift I have to be on a stage in Oregon, in Portland, and you all to get to listen to me for 40 minutes or whatever it is. So instead of me just talking about what policy needs to change, I want to ask you to do something for me and for those who still suffer. If you're a person in recovery, leave this gathering today, go back into your community, and sometime between now and Sunday, we'll give you 3 more days. If you're a person in recovery, share that with somebody who does not know it. If we want to change public policy in Oregon, we got to change it by changing public perception. And the best way to change public perception is for those of us in recovery to leave here, go back, and sometime between now and Sunday, share with somebody who doesn't know it that you're a person in recovery. Do it at the grocery store, your church, your running club, whatever. But share that with somebody who does not know it. Number 2, if you're a family member, leave here today, go back into your community and share that with somebody who does not know it. Number 3, if you're a professional, talk about your successes. And number 4, if you came here today specifically to hear about this subject, then we invite you to go back into your community and share with somebody who doesn't know it why you came here today. What was it that motivated some of you to come here and listen to me and hear from Dwight? What was it that brought you into these seats or bought you these tables today? Go back into your community and share with somebody, you know what, I was at the City Club on Thursday. Is today Thursday? No, today's Friday.
All day.
It's been a long week. Go back. I came to the City Club on Friday and I heard this addict and alcoholic in recovery share. And this is what whomever I is out there, this is what I learned. Go back into your community and share that we had this conversation today. That is the best way to get the policymakers in Salem or your members of Congress or your county attorneys or your district attorneys or whatever. That's the best way to shift our policy. So the magic wand I have is actually it's not magic at all. It's pretty rudimentary. It's pretty simple. I'll just wave this practical wand and ask you all to go back into your communities and talk about what we've talked about today.
Thank you. Let's now go to questions from the audience. You can ask questions. If you're not a City Club member, you can write a question on an index card, hold it high so staff can see it. You can also ask questions by Twitter using the hashtag Friday Forum and addressing it to @City Club. If the microphone is a privilege of City Club members and membership is open to all. I see we have a question from Bill Dickey, who, by the way, is a prominent businessman here in town who has long been a public voice around recovery, and we appreciate Bill's work there.
Thank you, Bill. Yay!
Bill Dickey, City Club member. Breaking the rule here quickly by not asking a question. This is City Club's time of the fiscal year when we're at our lowest point financially. We have a big break so we don't get Friday Forum money, and we start the season and we need donations. And so to prompt you to make a donation to City Club today, I'll personally match any donation made today. Woo. So if you write a check to City Club, I'll match it. 2, when I was sitting in the room today, I turned to the person I was sitting next to and I said, is he related to Bill Moyers? Because you reminded me so much of your father, and I didn't know who you were.
I'm sorry, I can't help it.
Anyway, that's a big compliment. 2, my question though is, and you've already really sort of answered it while I was waiting here, is how does, because, you know, as a friend of Bill W.'s for 22 plus years, you were taught to, you know, be anonymous, but as times have changed and social media has become so prominent in our lives, how does that affect the message that you get from doing your 12-step work and going to meetings?
And I've answered that, I think, but just to reemphasize, you know, as far as I know, I haven't still disclosed how it is that I recover. I've sort of, you know, suggested it. We can be advocates as people in recovery and not as any representatives of any groups. And I think that anonymity issue will remain vital to the continued thriving of the 12-step movement, even while we become more passionately advocate in these times.
Commissioner Sharon Myron. So Sharon is not only a lawyer, she's an emergency room doctor and a county commissioner and a mom.
Well, you should be up in this chair, not me.
I know.
She's a Kaiser Permanente
I'm
doctor.
so glad you're up in that chair. And thank you for being here today. Sharon Myron, City Club member, and those other things. And I think the question that I want to ask is I want to go back to Dwight's point he mentioned earlier about race and recognizing our country's history of harsh penalties for some drug users and sympathetic treatment for others. Generally along racial lines, even though most opioid users are white, how do we make sure that non-white drug users' experiences aren't masked or made invisible by this? That they still get the treatment and services they need that are actually culturally responsive, and that they're not and it's a long question, but that they're not disproportionately represented among those who are profiled, arrested, convicted, and punished for opioid-related crimes, despite representing a smaller share of those using.
And yeah. Well, I think you emphasized parts of the answer in your question, and so I laud you for that. Look, the reality is that the opioid epidemic has, as I said earlier, finally sort of woken up the rest of the country to the reality that a drug is a drug is a drug is a drug, and whether it's opioids or alcohol or all the other ones, we shouldn't be waging a war against people who have it. We need to make sure that treatment access is available to all, and that treatment access includes what is culturally appropriate or socioeconomically appropriate for the patient who's getting it. There is no one-size-shoe fits all, and what might work at Hazelden Betty Ford might not necessarily work on the reservation, for example. But what we need to be able to do is to use this opioid epidemic as a reason to once and for all stop this war on drugs and begin to embrace a holistic approach involving all Americans and treatment.
John Calhoun.
John Calhoun, City Club member. A stigma that you haven't discussed is the stigma attached to addicts with a criminal record.
Yeah.
Corporate America makes it really tough to get a job if you have a criminal record, which makes it really tough to recover. Can you discuss?
Yes, I mean, we could discuss that at our next City Club meeting all session. It's another great one. I was with the governor and first lady of North Dakota Monday and Tuesday. They did a statewide symposium on addiction and recovery issues, and the criminal justice piece was huge. The reentry piece after incarceration was enormous for exactly the reasons that you talked about. I think we've got to continue to hold people accountable, recognize that you break the law, you've got to be held accountable, but also perhaps put in incentives that allow people's records to be cleaned up, if not completely expunged, after a period of time of recovery or a period of time of not getting in trouble again while under the influence. It is the real quandary how it is that felons can get clean in prison, come back out, and be in recovery and not be able to rent an apartment, for example, or not be able to hold a job because they have a record that was occurred under the influence. Part of this changing in the paradigm shift has got to include reform as it relates to allowing people who have broken the law to start again without having one hand tied behind their back.
Let me ask a question from a index card, and then we'll get to you, Ed. Are you concerned about the new Trump appointee, Ellie McCants-Katz, the Assistant Secretary for Health and Human Services? Let me ask that question in a slightly more neutral way. What, if anything, can you tell us about Dr. Ellie McCants-Katz, the new Assistant Secretary for Mental Health in the Trump administration?
I don't know, and I have to be honest with you. I don't know about her credentials. Yeah, I don't know about her credentials. I will say that some of us had a lot of hope early on in the Trump administration. Believe it or not, we had hope around the area of drug policy, in part because the president was tapping into expertise of people like Governor Chris Christie of New Jersey, who, even though he had a lot of shortcomings in other areas, really sort of understood drug policy as it relates to what we're talking about today. Also, President Trump's brother died of active alcoholism in 1981. It's a front page story in the New York Times during the campaign, and he doesn't drink as a result of that. Unfortunately, so far at least, we have not seen the change that we had hoped for or that we need if we want to continue the momentum that we had largely under the Obama administration. In the meantime, though, we keep pushing. We keep pushing. I know Dr. Seppala has gone to Washington to testify before. We keep pushing with members of Congress, and we actually think Congress has a better understanding of the issue than does the administration. We hope that those Republican members of Congress will continue to try to educate the president and his administration so that we can push the ball further down the court.
Let me ask a follow-up just to get you on record on this. Would stripping the essential benefits package out of the Affordable Care Act have an impact on addiction and recovery?
Absolutely. It would be a huge step backwards. And as I said to my friends in red states last fall, be careful what you ask for. I spent a lot of time down in Tennessee and Kentucky and Alabama and Georgia last year, and those are traditionally red states that all went for President Trump. They were all treatment providers, and a lot of them were men and women in recovery. And I said, be careful what you ask for, because if we're going to strip away the Affordable Care Act, then we're going to shut off access to care for people who need it, whether you're from a red state or a state like Oregon.
Ed Hershey.
That's who I am, and I'm a City Club member. Mr. Moyers, I have a question about what you euphemistically referred to as that up there. I've had a familial experience with Hazelden several years ago, and while there was much to be impressed about, one impediment to the treatment in our case was the connection between treatment and religion. You talked about 12 steps. The subject in this case had a skepticism toward religion that he was able to use as a barrier to effective treatment. I'm wondering if you can comment about the nexus between religion and both your program and general treatment of addiction.
Sure, thank you. That's a great question. We're not a religious program. We are a spiritual program in the sense that we believe that a belief in a higher power, whatever you want to call it, is an essential component of filling the spiritual void that a lot of us have. It wasn't my religion that got me into recovery, and I come from a Southern Baptist background, but it was my spiritual journey that enhanced the treatment that I got and enhanced the recovery support that I had in a way that allowed me to know that I'm not alone. That in my case, or in the case of people who struggle with this higher power concept, there's no better higher power than what? Hope. Hope. And so whether it's God or Mohammed or whatever you call it, at the end of the day, what really matters is that we as addicts and alcoholics who oftentimes suffer in this spiritual malady of loneliness and isolation, embrace the reality that we're not alone, that hope can be integral to that process, and that at the end of the day, our journeys are not one, that mine is not a destination of my journey is not one of the mind, it's one of the heart. And so I try the best I can on a day-to-day basis to stay connected to hope as my higher power, and it works. So to each his own. And if you struggle with that thing up there, find it down here in hope.
So, William, one of the things we did not talk about that came up on an index card, research is unambiguous that medication-assisted treatment for opioids in particular is significantly more effective than a treatment without opioids for many people. Sorry, without medication for many people. Can you talk a little bit about the question asks about the stigma around medication-assisted treatment?
Sure, and again, Dr. Seppala here could speak to this with far more authority and resonance than I could, so could Heidi. But we are an abstinence-based program. That's what got us here. But we have recognized that as research, as science, as the medical community have brought to bear more research and know-how around this, that our understanding of addiction is such now that the appropriate use of some medications is appropriate, especially if it can help to tamp down the craving that opioid addicts tend to experience with more intensity perhaps than others. Dr. Sepala is the one who in this country brought into the abstinence-based 12-step model the use of Suboxone, for example, or Vivitrol in a taper program, not exclusive to anything else, but as an adjunct to that treatment and recovery process. There is absolutely room in recovery, in treatment and recovery, for the use of certain approved medications. It's not a panacea. Again, we don't believe there's a magic pill, but my goodness, we've already experienced, whether it's at our facility in Newburgh or in Center City or at the Betty Ford Center, we've experienced the fact that medications are helping to keep our patients not only in treatment, but also helping them after treatment to sustain their recoveries. So we believe very strongly in the appropriate use of medications in the context of our 12-step program.
Well, William, thank you very, very much. This issue hits so many people here today and so many people in the audience so deeply. I have had the enriching experience of meeting, but depressing experience of meeting moms and dads and sisters and brothers who have lost people, some of whom are here today. And I thank you for being here, those of you who are here. I'm tired of it. I don't want to meet any more moms like that. We got to make it stop.
So can I say one more thing in 1 minute? Because at the end of the day, seriously, you all are going to go back to your homes and to your businesses, to your schools, to your jobs. You're going to be the ones who can carry the message that we've talked about here today in the community-based way that will result in the community-based solution. You all are now more expert than you were an hour ago. You all are in the area of addiction treatment and advocacy. You also are carriers of those seeds of hope. And so I leave you by reading you these 3 paragraphs from a book I wrote a long time ago. It's the epigraph of my book, Broken. It says, a disciple asks the Rebbe, why does Torah tell us to place these holy words upon your hearts? Why does it not tell us to place these holy words of healing in our hearts? The Rebbe answers, well, it is because as we are, our hearts are closed. And we cannot place the holy words in our hearts. So we place them on top of our hearts, and there they sit until one day the heart breaks and the words fall in. I ask that you take the words you've learned here today, piece of wisdom, take it back and perhaps place it on the hearts of somebody who is still suffering with this illness. They may not get it this afternoon, but if you've placed those words on their hearts tonight, tomorrow, next week, next month, their hearts may break and these words will fall in. Thank you.
I'm going off script a bit because of you, Bill, Dickey. Thank you. First, I want to thank you for your challenge today. I myself have filled out my additional gift today already, so I want to give you all an opportunity to do so if you'd like. On your tables, there are envelopes. There's just a few on each table. If there's anyone who would like to make a gift, our staff is prepared to hand you an envelope right now. Raise your hand if you want to make a gift, and we will bring an envelope to you as well. I'm doing mine in honor of Bill, so thank you. We're out of broadcast time, and we'll have to stop for the day. If this program has inspired you to contribute to City Club, please do so, as we just discussed. I'm Lisa Watson from City Club's Board of Governors. Thank you to all of our guests today, and special thanks to Sam Metz and the Friday Forum Committee for their hard work to prepare. We're adjourned.